Stunting among Malaysian children increased from 17% in 2015 to 21.8% in 2019. But who exactly is most at risk of suffering from malnutrition in their early years? Dr. Ching, head of the Pediatrics Department in Hospital Sungai Buloh, gives his insights.
It cuts across all income groups, whether you are in the B40 group, M40 group, or so on. All of us are affected by stunting, and also your occupation, whether the mother is a housewife, works in the private sector, public sector, you are also affected by stunting in your family. Educational level, states, urban to rural ratio divides. So it's a very ubiquitous problem that is found all over all divides of life. And to actually pinpoint it, most of the references look at the maternal and child diet, and also look at the poor community, the B40s, minorities, especially the Orang Asli communities. And we also found during the COVID pandemic, the marginalized communities, especially refugees, unsheltered children and mothers, and these are the ones that actually are at the very highest risk of being exposed to stunting, besides the already underlying communities which I've said just now. So, so it's a very wide and multi-sectoral proliferation of this stunting problem.
The government aims to reduce the prevalence of stunting among Malaysian children to at least 8% by 2030. While Putrajaya has taken note of the issue, Dr. C shares what else is needed to achieve this target.
And the three principles regarding the management of the stunting in the country, like I said, it's all of society, all of country approach. You cannot just expect the medical profession or the primary healthcare providers to actually just play their part without the participation of the society as a whole. First, you need to address the underlying causes, which I've said just now, especially food security. I think that's one of the big, issues that people are talking nowadays, especially with the rise in prices since the 1st of July. We are having less on our table now with the amount of take-home salary that we have, for all families. I'm sure most of the vulnerable groups that we have mentioned just now will be heavily impacted by this rise of inflation and rise of food prices. Like I said, it's a very sensitive index in terms of food security in our country.
On top of this, there should be more focus on the 1,000-day period, which refers to a child's life from the day they are conceived until they have reached 2 years of age.
Good to note that all children across the world actually has the same growth trajectory, whether you are Malaysian, you are born in America, you're born in Europe. So the first 5 years of life, you actually have the same growth potential. So it is only by the influences of nutrition, environment, and healthcare facilities that these things are actually sometimes affected to a certain degree. So actually modifying a lot of these concepts along the way does actually help to prevent stunting in children.